About 1 man in 6 will be diagnosed with prostate cancer during his lifetime, but only 1 man in 34 will die of it. Dr. Adam Hickerson of Pomona Valley Hospital Medical Center tells us the facts about prostate cancer and the advances made in its treatment.
Prostate cancer is a uncontrolled growth of a tumor in the prostate. The reason it's a concern is it's uncontrolled and it's growing, and it can also tend to spread. So like any cancer, the main issues and danger arrives as it proliferates throughout the body and can kind of take over. Nowadays, most people are diagnosed fairly early with prostate cancer. The good news is that means that they're much more treatable. However, usually people don't develop symptoms because of their prostate cancer, and this is usually because it's diagnosed before it has actually caused the symptoms. Back before the PSA era, a lot of people did have some obstruction or blood in the urine from prostate cancer. And unfortunately, a lot of people developed bone pain from actually the spread of prostate cancer, and that was sometimes the first presenting symptom.
Dr. Hickerson explains the prostate-specific antigen test.
So PSA is a substance that's released from the prostate. It is something that we can monitor in the blood. It can vary somewhat with when it's drawn and other activities. But generally we use it to try to screen for prostate cancer, and if it's elevated based on your age and health, then sometimes that will trigger either a visit to a urologist and or a biopsy or things like that. So I've often been asked when a patient comes in with elevated PSA how they can lower their PSA. And it's a good question to ask because it's important that they know the answer, that PSA is not something that should be lowered. It is a screening test that's useful when it's monitored continuously and without change. And so if someone were to take an herb or something that may or may not have estrogen in it or things that could alter the PSA, we're actually not able to follow that patient very well, and they could actually be doing themselves some harm. The Urology Association still recommends starting either 50 or as early as 40 with an annual PSA and rectal exam for everyone, and especially those with a family history of prostate cancer. Fortunately, we are in an age where prostate cancer can be diagnosed early, so treatments like surgery or radiation tend to be very effective when patients are treated at an early stage or grade. That can vary depending on the aggressiveness of the cancer and how quickly it was diagnosed. We've always wanted a gold standard answer whenever we're deciding between two treatments, for instance, open prostatectomy or robotic prostatectomy. I can tell you that clinically, from what I've seen, patients who have robotic surgery clinically tend to do much better from what I've seen. When I see them back at their 1-week visit, they're generally up and around and doing very well. They're returning pretty quickly to their normal daily activities. I also feel like, it's hard to delineate by numbers, but I feel like I get a much better dissection of the prostate, which allows me two things. I feel like I have a lot better visualization of neurovascular bundles, and the goal in saving those and identifying those is to increase erections and potency after surgery. And I personally feel like I'm able to do a much better job of that robotically because of the visualization and the advanced instrumentation. I also feel like in reconstructing the bladder and the urethra, I can clearly identify sphincter muscles in a urethra that's very important to keep in the patient so that I can have a much better continence rate afterwards. However, the one thing that's really important, regardless of age and health, is a rectal exam. Because if prostate cancer is palpable or detected on rectal exam, even if you're elderly, it may still be worth knowing about and potentially treating because it's more likely to be advanced.